Hello, everyone. I'm Mike Jones. We're back here with tip number 33 in our Medical Exercise Training 101 ebook series. Now, tip number 33 relates to tip number 32. Both of these tips are looking at medical exercise training skills. And let me say this before we start. Skills are vitally important. And skills, you need to take time to learn how to apply skills. Once you apply skills, then you master the skills as you apply them, and particularly these are usually exercise or assessment skills. You have to learn the skill, apply it to the client, and then once you start applying it to a client, you now need to have the ability to apply these skills or the application of these skills through exercise and assessments to produce an outcome. So to manage the client to an outcome. We see a lot of people that want to teach in the fitness industry, but the question becomes, is your skill set to the point that you understand 100% how to apply the skill, but also you now have the competence to use the skill to produce an outcome? And then the next step is, do you have the level of competence and application to now teach it to someone else so that they understand how to manage the client through the exercise session and produce a positive outcome? So with number 33, if you would, allow me to read. What are considered essential MET skills? And I think this is important. These are skills that you should have when you finish with whatever medical fitness, medical exercise, or post-rehab certification you complete. Now, I said that we've identified 52 skills, but the critical ones, the 5 essential skills you must master before you begin offering MET services are as follows. Essential skills, number 1, you must be able to assess blood pressure. You must learn to use the sphygmomanometer as well as the stethoscope to measure clients' blood pressure, not simply an electronic blood pressure unit or cuff. Folks, the electronic cuffs are not as accurate as taking it yourself. And I guarantee you, if you ever have a situation where a client does have a blood pressure issue, and as a result of that blood pressure incident, they have a fall or injury in your facility, I guarantee you someone I ask, did you check their blood pressure? If you said you checked it with a automatic cuff, I guarantee you they're immediately going to confiscate that cuff and get an idea of how accurate it is and how often it's been calibrated. Please learn how to use the stethoscope and the sphygmomanometer, or buy a more expensive, a more highly calibrated blood pressure cuff, because the ones we see at Walmart and Target, and I'm not putting down Walmart and Target, aren't the most accurate ones. Number 2, you must also be able to determine heart rate, not by using a heart rate monitor, but by actually checking the client's radial or carotid pulse. Yes, folks, you may have to actually touch the client and get their pulse. You know how you count 10 seconds, you count number of counts, number of beats in 10 seconds, multiplied by 6 or whatever factor you're using. Okay, that becomes essential. You can't always leave it to the electronic items or monitors. Number 3, you must be able to assess the client's balance. You will see a number of clients with balance dysfunction. You must assess their balance easily and quickly to determine if they are an appropriate MET client. Now, folks, everyone's talking about balance now in the fitness industry. Balance starts with sitting balance. If the client cannot sit upright and control themselves, as I am doing, or they're slumped to one side and they only can stay there for a period of time, I can guarantee you when you try to stand that client up, their standing balance will be very, very poor, which may lead to an injury. So please understand, balance, normally in the fitness industry, we talk about standing balance. It starts with sitting balance. But even sitting balance starts with the client's ability to move in bed, roll around, move from side to side, push themselves from the lying position to the sitting position. So all of those things come into play, and that's based on our human developmental sequence. So number 3, client balance. Number 4, you must have the ability to identify red flags in your new client or your continuing client. The ability to identify red flags is a must. If you're able to identify red flags and refer the client back to the physician, therapist, or chiropractor, you may possibly save a client, save them some pain and some trouble, even save a life in some instances. This may certainly make you look more professional and receive a higher degree of respect from medical professionals in your community. Folks, you've got to always look out for those red flags. Those red flags say proceed with caution or refer the client back. And number 5, the 5th skill is the ability to take a thorough medical history, not just simply a PAR-Q, or they fill out the PAR-Q form and then you never look at it. actually ask them, how did this start? What was the precipitating situation? What meds are you taking? What treatment has been done? What is the doctor saying? Who have you seen for this condition? So then interpret and determine if the client meets your MET criteria. Now, we establish a criteria for all of our conditions in our Medical Exercise Training Institute protocols. Many MET professionals gather information in the medical history and don't review the history to determine the impact of the client's previous medical issues, how they'll impact the client's exercise program. So the ability to perform a medical history interview and take that information, interpret it, not from a standpoint of diagnosis or treatment, but for exercise programming is vitally important. Every medical exercise professional should know how to do that. Now, the reason we put this tip in is because what I'm starting to see now in the medical exercise and medical fitness industry is just simply this. Oh, client has that condition, just do these exercises. Or what exercise do we do to fix that? Folks, it's not that easy. You're not just simply giving a client an exercise program. You may be tasked with managing their medical condition with an exercise program, not to take the place of the doctor, therapist, or chiropractor, but to provide these exercise services that augment the medical services that they provided so we can keep this client at a high functioning level. So with that, please make sure you go over to MET101ebook.com, download a copy of the ebook. I think you'll find it interesting. And if you have any comments on this, please email me at drmike@postrehab.com. Don't forget to subscribe so you can get the next video. Take care. Thank you for watching.